about the multisystem inflammatory syndrome in kids. The multisystem inflammatory is a lot like a previously known entity called Kawasaki's disease. And with both of these, there's pretty significant widespread inflammation. So it does affect multiple organ systems, including the heart, can affect the liver, certainly affects the blood vessels or the endothelial lining. There's a fair amount of inflammation there. The good news is after some initial outbreaks of this multisystem inflammation, I haven't heard of a lot more cases. That I know of, no children have died from the multisystem inflammation. We have not had a case admitted to our hospital here that I'm aware of. I think there have been some maybe suspect cases that presented to the emergency department, but even those I have not heard official confirmation on a diagnosis. So basically this is a syndrome that follows an infection with coronavirus, could even follow it by a few weeks, and involves inflammation in multiple body systems and can be quite significant and does require treatment. Things to look for would be a fever lasting longer than 5 days. Children will often have bright red inflamed eyes, and specifically the conjunctiva, which is under the lower eyelid. They can have swollen tongues. They can have a large unilateral or one-sided lymph node in the area of the neck. They can have a fairly significant rash that causes peeling and inflammation to the hands and feet. So if you have any one of those symptoms, particularly the fever greater than 5 days, and you have a known particularly a known exposure to coronavirus some point in the last month or so, that could be a good idea to be seen by a doctor and possibly even the emergency department. We do have treatments for that seem effective, and those are the same as those for Kawasaki's disease, namely IVIG, or intravenous immunoglobulin, is a treatment that's been a mainstay of Kawasaki's disease and has been shown to be, I believe, fairly effective in the multisystem inflammation. So there are some treatments for that part or that complication of COVID should that arise.